We're now in week 5 of the vaccine rollout. Still millions of doses going unused despite high demand. Take a live look right now. One vaccination site in Miami. Cars starting to line up for hours. They've all got appointments, but just getting the appointment has proven to be a real challenge all across the country. Here with more on the rollout is CNBC senior health and science reporter Meg Tirrell. Meg, good morning. Thanks for joining us.
Oh, my pleasure.
Well, okay, so the latest update on the vaccine rollout is the opening of these super distribution centers all over the U.S. So is this a step in the right direction to try to speed this process up?
Experts say it absolutely is. We're really entering this sort of new period of the vaccine rollout where you're seeing these mass sites in convention centers and stadiums all across the country really starting to come on board. Up until this point, it was really just hospitals and nursing homes that were giving out these shots. So it is starting to move more into the community. We are going to see pharmacies as well, the big chains like CVS over the coming weeks also starting to get these vaccines and starting to enable you to make appointments on their websites. And that will really increase capacity as well. CVS says it can do 20 to 25 million vaccinations for COVID-19 alone every month. But the problem is going to be getting the supply of the vaccines to actually be able to do that many. So this is a start, but just a start.
On that note, Meg, West Virginia is leading in vaccinations per capita right now, with first doses being administered at a rate of 70.5%. That's according to their governor's office. What have you found in your reporting as to why some states are doing better than others with the rollout?
It's such a mixed picture right now. I mean, 50 different states have 50 different plans. And what we've seen work really well in West Virginia is that they took it on themselves to get into their nursing homes, to get those vaccines to really vulnerable folks there. And they've had a lot of success in that way. You know, one of the things we're hearing about around the country is that some of these prioritization groups have been kept too tight. And there's been an urging from the federal government for states to really open that up, the way you've seen Florida and Texas do, for example, to more seniors. But that, of course, leads to these incredibly frustrating situations where it's impossible to get an appointment. So it's still very frustrating right now.
Meg, President-elect Biden announced on Friday a plan to administer 100 million shots in his first 100 days in office. That's a catchy promise, but is it realistic?
You know, it's sounding more and more like it is realistic. On Friday, we got new numbers from the CDC on where vaccinations are, and they added more than 750,000 new shots administered in that one day. And so we're about 3/4 of the way there. You know, NIH Director Francis Collins has said that 1 million vaccinations a day is also a good benchmark to shoot for. It's achievable, but at that pace, it would still take us a long time to get to, 80% of adults or so that people say we need for herd immunity. That would take us more than a year, so we still need to speed up even more.
And Meg, we're starting to see many states widen the eligibility for vaccine. I have some friends who've actually gotten an appointment down in Florida, and they plan to drive down. What are some of the tips on how to get in line?
The first thing that everybody needs to know is where they fit in line. If you are a young, healthy person, right now is not the time you're likely to be able to get a vaccine unless you're in a prioritized group of frontline essential workers, for example. So figure out where you are and when you can expect to potentially get a vaccine. In order to do that, go to your state, your city, or your county health department website. They should have information there about their priority groups. They should also have information about if there are vaccine signups available. Make sure to put your name down, put your information down. Another place to look is your local pharmacy. Talk to your doctor's office. They should have information either about if they have the vaccine or when it might be coming. And then finally, your employer is another place to ask. They might be getting information from the state or the county level and can tell you when your group might become eligible.
All right.
All right. Meg Tirrell, thank you so much for that information. Really appreciate it.